It's been said that the definition of insanity is doing the same thing over and over and expecting a different result. Well, I have a physician who is the founder and CEO of WellPrept, who has a solution potentially to stop us from doing the same things over and over and expecting a different result. And this may just help us minimize the burnout that is happening, that you see so frequently reported among physician surveys. I'm excited to have Dr. David Canes, who's a practicing urologist in the Boston area, who happens to be the brave founder and CEO of WellPrept. And he is going to talk about the product that he has created to help with physician burnout, increase our efficiency so we can stop repeating ourselves over and over again. Welcome to the program, and thank you so much for coming on.
Thanks, John. It's a pleasure to be here.
So
Thanks for inviting me.
So tell me a little bit about why WellPrept. How did all this start?
So it all started with absolutely zero intention to start a company. I mean, that was pretty far into it when it became apparent that something had been created that might be of use to other people. It began just as something to scratch my own itch.
So what was going on? What was happening in your clinical life that you thought, okay, we need to fix it?
Yeah. So around 2015, 2016, I was dealing with burnout in various respects. And one of the things that bothered me was feeling like I'm sitting in an exam room with a patient and I'm pressing play on some kind of spiel that I have. And I come out the other side, not even remembering what I had said. I get into like robot mode. Still, of course, trying to make a connection and have empathy. But, I remember specifically one day when I was in the room with an engineer. He was in his 60s, just diagnosed with prostate cancer. And I enter into my Gleason score explanation. And I've heard myself give this talk hundreds of times. I reached the end. I don't even remember speaking. And it's this feeling of disconnect from the person that's sitting across from me. And, one of the reasons why I was attracted to being a doctor in the first place is because we have this privilege of being able to really make meaningful connections when you're present in the moment with another human being who needs your help. That's very gratifying, never gets old. But when you remove yourself from that because of some kind of repetitive task, it becomes a problem, or it became a problem for me. And so that's where it all began. And I was just searching for solutions for this. So on this one day, I took the PDF for the NCCN patient guide and I uploaded it to my Google Drive, and I made a short link for it because that Google Drive share thing was like massive. And I asked my administrative assistant, listen, from now on, if somebody's seeing me for prostate cancer, could you please email them this PDF to read? And not everybody read it, but slowly but surely, patients started to read it. And the visits with those patients was incrementally better. And what I found was that when you take those repetitive explanations out, you leave space for so many other great things. Like, when people take out that clipboard, with the questions, when it's packed into the last 2 minutes of the visit, I used to recoil like, oh God, I got to answer these questions. And now we could start with those questions, which is only fair really to the patient. They took the time to write the questions out. They're good questions. And it becomes a real conversation because I can't always predict what they're going to ask. And the questions pertain specifically to their situation. And I think there may be other doctors like me who enjoy those specific personal conversations. And, I should say it's not only about our enjoyment, but we do have to do this for decades on end. So our engagement is important, but it's also good for the patient to have a more detailed discussion about whatever it is they're coming to see us for.
So, speaking of questions, for those of you watching this on the live stream, or if you're watching this on the replay, please feel free to ask any questions in the comments, and David and I will try to answer them either during the live stream or on the replay. Speaking of questions, all right, so you see this prostate cancer patient, and you've given the talk track many, many times. Similarly, I see a lot of vasectomy patients, 1,200 of them, as a matter of fact, last year alone. And I give the same talk track over and over. And I can totally relate to you saying you feel like you're on cruise control. You don't remember that conversation you just had. And really, you want to answer the questions that the patients have and not just the cursory explanation that we always do over and over again. And it sounds like you found a way to improve that by creating a short URL that you have your administrative assistant send to the patients before they come into the office, so they have a good or better understanding of their disease process. And then by the time they come in, the questions that they have written down, you have more time, number one, more time to answer them. And number two, they're probably going to be better questions.
Exactly. So that's exactly right. I mean, it grew from that one PDF. I took it to the next level, and I recorded a video of a robotic prostatectomy explanation. And by the way, for your vasectomy spiel or my robotic prostatectomy spiel or a Gleason spiel, I think each of us has, or I'll speak for myself, there's a 10-minute really great spiel, a 5-minute okay spiel where you gloss over some things, and a 2-minute very rushed spiel because you're running behind, and it does them no service. So I recorded one really great explanation of robotic prostatectomy, uploaded to YouTube, and I started telling my secretary, all right, now send them the PDF and send them the YouTube. And she started to get annoyed with me. So if there was a light bulb moment for me, those link in bio companies that have started to sprout out about, surrounding social media. On Instagram or Twitter, you're only allowed one link in your bio. And so companies like Linktree created these very simple pages with stacks of buttons. And when I saw that, I thought, again, not thinking about starting a company, I can make this easier for my secretary by only sending one URL, and I'll put my resources on that page. And it was only when I started to do that, and I convinced some urology friends of mine to try it out in their own practice. I built them a prototype using a similar interface. And enough of them really loved it. It sort of weaved its way into their workflow to the point where they printed their business cards over with QR codes for their patient education stuff. And so it was that moment when I thought, all right, there's probably other doctors out there whose workflow this might fit into. Not everyone, but doctors who are very organized with their EHR templates and try to use technology already to help mitigate burnout and improve practice efficiency. This is now another layer using patient education to try and augment that particular niche for us.
Yeah, I totally get it. And now I got the link from you, and I'm going to show on the screen here your website called WellPrept. And it says patients prep for your clinic. Stop repeating yourself over and over. Don't struggle with practice efficiency. Send patients to your own personalized education pages, and you can start building the WellPrept pages today, start using them tomorrow. Well, I got the link yesterday, and I started building them yesterday. And you made it pretty easy when it comes to urology. I understand you want to start with urology and then possibly expand to different specialties. This is my administrative page. This is not the patient-facing page that I have on the screen here. I've got vasectomy, BPH, kidney stones, blood in the urine. And if I click on vasectomy, it'll show multiple potential links, my recommended videos, and it's already pre-filled out for me, which I thought was pretty good. And then recommended resources for vasectomy. It's got the JAMA vasectomy overview, EAU information about vasectomy, the procedure, what is a vasectomy, is links to a website, and a podcast from, I think, the AUA, What to Know About Vasectomy. So it's already built in with a lot of resources. I didn't even have to put in a lot of the information. It's already there for me when it comes to urology. Now, when I build this, after I build this, how is that used when you see patients?
All right. So are you still showing the dashboard, or have you clicked off?
I can still show the dashboard. I'm
Yeah,
back
so
on
if
the
you go to the
dashboard.
So if you go to the dashboard, and you go to the vasectomy tile,
Yeah,
and you click on that share section on the
got it.
right-hand
And
side.
there's a big old
So
QR code and a
yeah,
URL
so
link.
exactly. So each one of your condition pages has its own URL and its own QR code. So let's talk about a couple of use cases. The best way to use WellPrept is if you can get it to to your new patients before they arrive.
Got it.
And that's going to look different in every practice. If there's an administrative assistant in your practice, or some practices are lucky enough to have nurse navigators, although that's rare, somebody who's making the appointments, you tell them, this is now part of the workflow. Here's a list of conditions I see. If you're making an appointment for one of these, please ask the patient to read the resources and watch the videos on this link. They can email it to the patient, or how they get it to the patient is up to your workflow right now. In future iterations, we imagine EHR integrations where that could be done for you, but that's not there yet. Right now, we're relying on the person who schedules the appointments. Now, a lot of early access users have said, I don't have a reliable administrative assistant. They're overworked. There's no way I can put anything more on their plate. So what a lot of users are doing is this. You look ahead to your clinic, and let's say you're seeing 30, 35 patients, and 9 of them or 10 of them are new. I actually have been telling people to do 2 things. One is email the patients, and I template out an email which says, you're seeing me on Wednesday for vasectomy consultation. I've organized my favorite resources, videos, and links on this page. Please review it before your visit. Now, people have told me they were initially nervous. Well, patients now have my email address. Are they going to abuse it? Shockingly, almost nobody replies back, but they do get the email. So that's number one. As a second layer, I don't know if you use Doximity Dialer, John, but Doximity Dialer now has one-way HIPAA-compliant text messaging, and you can create templates. So what early access users have done is, let's say they have 12 pages. They create 12 templates. Each one says the same thing except a different URL. And so it's a matter of just typing in the patient's mobile number, which is always collected in the EHR, and clicking can text BPH, send. So it takes about 3 minutes to send an email and a text to everyone, all your new patients, in advance of a clinic. And I'll tell you, the first time you have an aha moment when the patient comes in and they go, thank you so much for sending me those resources. It was really helpful. And then you see what your discussion is like with them after they've reviewed whatever you want them to review. It's awesome. It's awesome for the doctor. Patients deserve to have that kind of thing. And it opens up a whole world of possibilities. For example, in prostate cancer, I almost never gave patients links or resources about support groups. I knew that it was something that I really should do every time, but I never did it. Now on my prostate cancer page, I can have a support group link or a handout. You can upload all your handouts here. And so patients can get a more uniform experience. Now everybody gets that. Or let's say I want everyone to get GoodRx coupons for sildenafil, or to go to Mark Cuban's Cost Plus Drugs. I can put that on my erectile dysfunction page, and again, create more of a uniform experience for everybody. Or I come across an article in the New York Times on something that I think it would be really great for everybody with such and such condition to read. I just have to put it on my page. I don't have to ask the web team to do it or call the marketing team. This is all self-service.
And I will tell you, you just sent me the link yesterday to Self Onboard yesterday. It's pretty darn easy. I've already uploaded my picture. I changed a lot of the links. I organized the topics and arranged them in the order that I want. So it's super intuitive.
Thanks for saying that. We spent a lot of time trying to make the onboarding process enjoyable and quick and frictionless, and so it means a lot to hear you say that.
And I can customize my introduction video, so it's actually my video that I have unlisted URL on YouTube, and I just copy and pasted it there, and then it was done. So the other thing that I was thinking about is that your staff can just generically send a link at app.wellprep.com/JCLINMD or something like that. And it's going to give a list of conditions. That way, if you don't have a HIPAA compliant email, you can just send this link. And it doesn't say that you have prostate cancer. It doesn't say that you're coming in for BPH. So
so what you're saying is the way WellPrept is structured is everybody has a main page where there's a meet the doctor section front and center, and all your conditions are listed below. Or the front door can be directly to the condition page. You can decide, but what John's saying is absolutely right. You could just generically send everybody to the main page. They can find their condition and go from there. Just to tell you other use cases for how this can be done, again, I would emphasize the most powerful use case is getting it to patients before they show up. But if you don't, you can show it to them while they're there. What a lot of people have done, and this is pretty cool, people are telling me that their file cabinets are now empty because they've scanned all their handouts. They no longer, they scanned a couple of brochures they liked and put them on their page. So they no longer have stacks of brochures. They have one stack of paper with their QR code on it. You know, a stack of 100, because sometimes it is still nice to hand patients a physical piece of paper.
And you can circle maybe that QR code and say, here, I want you to look at that condition.
Exactly.
Got it.
Now other doctors have put blurbs in their after visit summaries. They put their QR code and their URL as a dot phrase or a template into their after visit summaries, and so patients are leaving with it. So again, they can have it on the way in, which I think is the best use. They can have it on the way out. Here's another nice anecdote from early access user. They're on call. They're going to the ER to see a stone. They're going to place a stent. They consent the patient. They mark the patient. And then they log into their dashboard on their mobile phone, and they physically show the QR code for their kidney stone page, and the patient scans it. You know, they're all sitting in the stretcher with like an iPhone 13 Max, right?
Totally. They all are. You know, what I do is offer to take a picture of them and their spouse sitting next to them using their phone.
Oh, that's a nice move. I like that. I'm going to steal that. So think about this. You see the patient in the ER. By the time you actually are wheels into the OR is like best case, like 30 to 45 minutes, but likely longer. Now the patient's sitting in the stretcher and they're watching, for example, the Urology Care Foundation video about what is a stent, a video about what is ureteroscopy. And all these things are already, you know, these resources exist already on the web, and they're fantastic. You can put your stent discharge instructions, like for example, from Music Urology, they have fantastic stent postoperative instructions. That patient, I want that patient to have a mental image of exactly what a stent is, because there's going to be fewer phone calls. They deserve to know as much as possible about it, right? So all that idle time where they were sitting there doing nothing, they can be learning about it. And then, by the way, when a family member says, "Oh, what happened?" they're forwarding the WellPrep page. They're just like, "Oh, just look at this page on kidney stones."
Yeah, that's what I had done. That's the surgery that I had done. Yeah. And
Yeah,
also
exactly.
you are the person curating, or your practice is the one curating the content, instead
Right.
of patients getting information just flat out wrong or just bad information online. And I see that
Right.
all the time on different Facebook groups for different conditions like sleep apnea or kidney stones or BPH. There's just bad information being peddled out there. So be able to curate your content using WellPrept and it's really easy to just copy and paste the links into WellPrept and share that information with patients. So
Right.
I think more and more people, as they get comfortable, a lot of people, some people still don't know what a QR code is, but once
Although
you
I'll tell you, one thing that happened with COVID is it brought QR codes out into the limelight.
definitely, it's been around forever.
Right.
And
Yeah.
also, anybody can create these QR codes. There are apps that you can use to create a QR code to a link, like say to your website or something like that.
Exactly.
Yeah.
Exactly.
So it's pretty straightforward. I think more and more people are used to it. And if for those who are not, you still have that custom URL for the condition that you prepared for the patient to see that you can share.
Yeah. A couple other things I want to point out. One is in your dashboard, it has a live view count
So
of how many.
let me go back. Let me share my screen again, and I'm gonna share in my dashboard. Okay, go ahead.
Right. So if you look at each condition tile, it says page views, and most of them probably say 0 right now.
Correct, because I
But
just started yesterday.
right. But as you start showing patients, as soon as a patient goes to any one of these pages, the view count updates and starts off 1, 2, 3 views. And as you incorporate into your practice, 300, 400, 1,000 views. And you can see a spike happen after your clinic day for the next few days. So it's nice feedback to know that the effort you put into curating these pages actually pays off, that patients are consuming the information and they visit the page and they keep going back to it.
What I'm thinking is that if this information is good, these patients may simply share that code online to their friends. And so
That's true.
sometimes the view count may go up even more.
Yep, that's true. Now, one question that I get asked a lot from employed doctors, but even doctors in private practice, I'm not sure if I'm allowed to do this. And I always get tickled by that question because as a group, doctors, we're very deferential and we like to wait for permission for things. The way people have been looking at this is it's sort of like a LinkedIn profile or a Doximity profile. You didn't ask permission to make those. It's just another profile online where you can put your patient education materials that's optimized for sharing. That's it. And what I'm hearing from the first bunch of users is that sort of a sense of relief, like, okay, now I'm in charge of what's on this page and I get to decide what I think is a good patient educational resource. And I don't have to ask permission from anyone. And that part about this feels really good. And it feels like it's about time.
So I think a lot of burnout involves the loss or lack of control, whether that is the type of employees that you get to use, the schedule that you have, or the type of patients, the payers that you wish to engage, and including the content that you can or cannot share online. So this is just one way for the physicians to take control as well. So that's another way to decrease burnout.
Exactly. I mean, we're responsible. We're a very responsible breed. We're not going to throw up a bad video on our page or a terrible handout. I mean, it all reflects on us. We're in charge of what's on our page. And we're also, when it comes to websites, we're used to getting help from somebody, either hiring somebody waiting for the marketing department to help us or something. And here it's completely self-service. And that part, I think, feels good for people as well. This is, my page, and I can edit it and update it whenever I want.
Yeah. And it's fast. It's really fast. And it seems like you've created to be a very mobile friendly type of an app or a website, if you will.
That's right. I mean, we made some design choices early on for the sake of simplicity of the first version, where it basically looks the same whether it's on mobile or desktop.
Yeah.
So you can make changes on the fly from your phone, just as you can on a desktop.
Yeah, it certainly is. Like I said, it's pretty intuitive, and you can make the changes right away. You can customize the video, you can customize the document, you can customize URL links to other sites. And what is really cool is that it's already pre-populated with urology stuff, including a lot of pediatric urology conditions. So you can click on a pediatric urology condition, and it's got a bunch of resources already filled out, already pre-populated. So for those who are just starting out, they don't want to have to deal with all the content that has to be populated. You can just turn this on and go. So tell us a little bit about how do you acquire or sell or subscribe, or what is the business model for this?
Yeah, so the business model is is going to be subscription based. It'll be a monthly fee, a modest monthly fee per user. Right now, I'm focusing on getting it out there and showing the value of this to as many people as possible without focusing so much on the business model just yet. But and to your earlier point, it was very clear to me, since I'm a practicing urologist, that if somebody handed this to me and it was completely blank, I probably wouldn't go further. So that's why we wanted to make it such that, the very first entree, the pages are at least fully populated. If you wanted, you wouldn't have to do anything. You could just show it to patients the next day. But as you get into it, you can remove resources you don't like and put your own on there.
It sounds like you already have this minimal viable product, more than minimal viable product, especially for urology. And how do people, if somebody's interested, how do people get a hold of you, or how do people sign up, or how does that work?
Yeah, sure. So there's a number of ways. The easiest way is to go to wellprept.com. It's WELLPREPT.com. And there's a way to put yourself on the wait list. That message goes right to me, and I'll reach out to you. Or I'm pretty easy to reach on Twitter. The handle is @CanesDavid, CANES David. And you can DM me, hey, I heard about it. I'd like to try it out. As John mentioned, it takes you 5 minutes to just do the onboarding, and then you can tweak it over the next 15, 20 minutes, and you're probably ready to go. What I encourage people to do when they start out is to set an artificial deadline for themselves, like next Wednesday's clinic, I'm going to show it to at least one patient. You got to kind of rip the Band-Aid off. And again, I don't want to generalize about doctors, but we want things to be so perfect before we change our workflow, and just, show it to one patient and watch them, smile and leave with something tangible in their hand.
And it's customized. So a lot. Customized. So the problem in medicine is that so many people say this, and I'm sure you've heard this before. We've always done it this way, and it's worked okay. So we're going to continue doing the way we've been doing things, and that is pervasive in medicine. That is called status quo bias. We want to stay the same because change is hard, change is difficult, and you can come up with all sorts of excuses. Oh, it's not perfect. I don't have it perfectly tuned, so I don't want to start using it. Well, things are never perfect, especially in medicine. Medicine's never perfect. That's why they call it practice of medicine. So just
exactly,
if you have a good technology, good piece of software, just start using it and see your patient's response, and see how they respond, and how it makes how a piece of software, a piece of solution will make your life a lot easier. And I was just showing the webpage for WellPrept, and I'm looking at this bottom section. Says doctors use WellPrept at Fox Chase, UPMC, New York University Lutheran, WVU Cancer Institute, University Hospitals, and MedStar Health in Beaumont. So that's pretty darn good. You already have quite a significant amount of adoption.
Yeah, I mean, I was fortunate to have trusting colleagues who were willing to go out on a limb and give it a shot in their practice, which I'm eternally grateful for. After that, it kind of spoke for itself, and they wanted to keep using it. But just to pick up on something you just said before, speaking of status quo, let's think about what the status quo is for patient education materials. Okay. And I know it's a small aspect of what we do, but I think that it is a forgotten aspect of what we do. We all have, if I went into any person who's listening's office and I said, bring me to the file cabinet with all the handouts, you would take me somewhere in your office to the dusty file cabinet with over photocopied handouts for bladder irritants and voiding diaries. And we all have it, right? BCG instructions and how to care for your Foley catheter. You just scan your favorite ones, you put them on your page. There's no more coming out of the room and asking, the MA, oh, hey, can you find the handout for blah, blah, blah? No, that's over. It's all on your WellPrept pages. You never have to look for them again. And then, since you have this delivery tool, you might want to make your own handouts. Now that you have an easy way to distribute them, here's what I'm finding. This was a hypothesis, John, but I've seen this play out with at least a dozen people. Now that they have this distribution tool, they had never recorded a video of themselves before, but now they went, and in the next week, they record 10 or 11 low-budget iPhone video explanations. That's another example of people kind of
basically empowering. Basically, it sounds like you're saying you're now empowering physicians.
Yeah. I
mean,
now
they see what's possible and how easy it is.
Yeah, I mean, and it's starting to feel. I don't want to be cliche here at all, but it's starting to feel like a really important mission to get to at least show people. And it may not be for everyone. It's not for everyone's workflow, but it seems to be for people who are already leveraging technology in their practice. Even something as simple as they have templates in their EHR and dot phrases and order sets, and they use that. I mean, that's what I mean by leveraging technology. And, we were talking before that takes time to set those things up, and it'll take a little bit of time for you to get your WellPrept pages set up to your liking, but it helps your future self. And I feel so strongly about this, that we need to move away from this concept that all we do is we interact with patients one-on-one, and it's one surgery, one patient at a time. Think about prepping for your clinic where you've got 30 patients and it's the day before and you're trying to get your charts ready. What are the patients doing at home the day before clinic? Nothing. They're doing nothing. And that can change. A little bit of technology, and all of a sudden, all the new patients are sitting at home watching some videos. And it doesn't even have to be you on the video. It could be a colleague's video that you like, that's already done, and they're reading your handouts, and they're reading the NCCN guide for this and the AUA Care Foundation pamphlet on. That's the other thing that I've realized here, that fantastic resources are out there. They already exist.
And so I really appreciate the curated list that you already created for this initial run of WellPrept, covering urology conditions.
Right. Yeah. No, I mean, thanks for saying that. I've been impressed at the very high quality resources that already exist. And I sort of feel like, what was the plan exactly to get those in front of the right patient at the right time? It was sort of, we hope that somehow these resources find their way into patients' hands. And I don't think that's how it should be. It should be each doctor kind of distributing it out to their patients as they go.
Well, very good. I'm going to read a couple of comments. Meredith Caroline says, way to go, David Kane. WellPrept is a fantastic tool. Looking forward to putting it to good use once fellowship starts up. And Dr. De Laurentiis asked, since I joined late, what is this resource called and that you are using to do this? Okay, so I think we have it in the, I replied to him as wellprep.com. Well, David, I think we've covered quite a lot of information. Any final parting words?
Yes. Two thoughts to part with. One is, I've read burnout articles over the last 5 years, and nearly every one says, it talks about mindfulness and meditation and resilience, and all those things are very important. But then at the end, it says, and systems level changes are needed. And the question is, where are those systems level changes going to come from? For the longest time, I was just sort of patiently waiting, assuming that somebody was working on it and somebody's going to help us. And I don't think there are people waiting to help us. So I feel like these changes have to come from us together as a community. They have to come from the ones who are doing the work, who understand what the problems are. And again, I don't want to overstate this. This is a small improvement to one aspect of the way we take care of patients. But I mention this because maybe there's somebody else listening who has another idea that they're not sure about pursuing that's going to help us. I think the biggest help to our community of physicians is going to come from us, not from somebody else.
Just like in self-defense, you are your first and best first responder. Really, no one's going to come to help you, and it's really up to us to advocate for ourselves. And taking some of that control back using software such as WellPrept is one of the ways that we can regain control and hopefully decrease burnout. Thank you so much, David, for coming on and sharing your product and idea.
Thanks for having me, John.
All right. As usual, for those of you watching this on a replay, feel free to ask any questions in the comments. David and I will try to answer them the best we can. Take care of yourselves, take care of each other, and thank you for the privilege of your time. Bye-bye.